This is Dr. Manisha Jhawar from Surat. Friends, uterus is a small 7 centimeter organ which grows by 7 times in a span of 9 months of pregnancy to give space to the growing child. And to feed the growing child, the small blood vessels of the uterus become big and broad, and many new blood channels develop so that the blood flow to the uterus is 700 ml every minute. And 700 ml means 2 bottles of blood. After delivery, the placenta separates, leaving behind these blood vessels pouring blood at high speed. But the uterus also contracts immediately after delivery, squeezing these blood vessels to stop the heavy blood loss. What a miracle of nature! When the blood is required to feed the child, the tap is opened, and when the job is over, the tap is closed. But unfortunately, nature also fails at times, and few mothers keep on bleeding even after delivery in spite of all the efforts. This heavy bleeding occurring after delivery is known as postpartum hemorrhage or PPH. This PPH is so deadly that it can kill a perfectly healthy woman in 2 hours, and it can kill anybody. It can kill even a queen. Mumtaz Mahal, in whose memory Shah Jahan had built Taj Mahal, had lost her life to PPH. It's good to note that of late, because of good antenatal care, good nutrition, good availability of blood banks, and good techniques and surgical techniques, we are able to save many mothers from this deadly PPH. Just imagine the amount of stress a doctor is going through when the patient is bleeding. In such testing times, the life saving do or die decisions are to be taken with a fearless mind. And in past, doctors have saved many patients by their fearless attitude from this deadly PPH. But the recent suicide of Dr. Archana Sharma of Lalsot, Rajasthan, because her patient lost her life, she tried her best to save the patient. Even the relatives appreciated her best to save the patient. Even the relatives appreciated her efforts. But the local police, under pressure of local politicians, filed 302 against her and instigated her to commit a suicide, forgetting she has two young innocent children. How can doctors work under such pressure? It is very important to understand that doctors should be practicing fearlessly to save more and more mothers, and it is very important to keep away from the foul minded politicians, police, journalists, so that doctors can do their best and save more and more mothers. Jai Hind, Jai Bharat.